You always want to use the 6 rights of medication administration. You want to make sure you have the right patient, the right medication, the right dose, the right time, the right route, and the right documentation. So I'm going to wash my hands. I'm going to come and look at my physician orders and my medication administration record for my patient Skip Rocker. He needs a heparin 5,000 units subcutaneous every 12 hours for 3 days. The heparin ampule contains 10,000 units per milliliter, so I'm going to get 0.5 milliliters for my injection. I'm going to come into the medication room and pick up my ampule. Sometimes the liquid gets stuck at the top, so you can kind of flick your wrist quickly or kind of tap it a little bit and get the air out of the top. I'm just going to make sure that this is the right heparin dose and everything, so that's good. You want to get a gauze pad and wrap it around the top. You want to break away from yourself, and you're going to put that in the sharps container right away. You are good to set that down. So I have my needle here, and I'm actually going to trade out the needles. I want to get my filter needle. So you're okay to touch this at the hub. And careful not to touch anything. Kind of twist a little bit. So you have your filter needle. You can put it in, and careful not to touch insides of anything. Keep it as sterile as possible. So we want to get out the 0.5 milliliters, and when you do that, it's also going to aspirate some air. And you want that air, so you want 0.2 milliliters of air. So you're actually just going to watch the fluid as it comes out because of that air. Okay, you are good to tap back. So I have 0.5 milliliters of the heparin shot, and I have 0.2 milliliters of air. At this point, you want to put your other needle back on. You cannot do injections with a filter needle. So you're going to scoop it up. You're not going to touch it like I did. You're going to scoop it up, cap it, and put it straight in the sharps container. And this is also going to go into the sharps container. And then you want to put your needle back on. Not like that. Okay. Your needle back on, and you're just touching it at that hub there. Now you are good to go see your patient. So I'm going to enter the room. I'm going to introduce myself. Hi, I'm Abby. I'm going to be your nurse today. I'm going to look for 2 patient identifiers. I'm going to look at their wristband and ask them their name and date of birth. I'm going to go into their medication administration record, and I'm going to check for allergies. And I'm going to check that I have the right medication, heparin, with the right dose, the right time, and the right route. So for heparin shots, you want to do it in the abdomen, the lower abdomen. It's subcutaneous, so you want to get the fat down there. So I have my patient here. I'm going to get them in position. There. Pretend my tomato's laying down. Okay, so then I'm going to get some gloves on. I'm going to get my alcohol swab. You start in the middle and come outward and allow time to dry. You are going to want to kind of pinch the site a little bit when you're ready, but you're going to get your cap out or off your injection. So you're going to pinch the skin with your non-dominant hand, and with your dominant hand you want the bevel up. You're going to go at a 90-degree angle. Okay. And then you want to inject it a little bit slowly. And you also want to inject the 0.2 milliliters of air. Okay. Then you can remove it, put it right in the sharps container. You can blot it with a gauze, but you don't want to rub it or massage it, and I advise the patient not to rub it or massage it either. So at this point, you're going to do your documentation. So you're going to document that you gave the heparin, at what dose, what frequency, so it's every 12 hours for 3 days. You're going to document the site that you put it on, so that was their lower left abdomen, and the time and initial.